This court's now in session. Please be seated.
Your Honor, for the purpose of the record, we return back to the trial of Commonwealth versus Lindsay Clancy. All parties are present, including the defendant and including the 18 jurors.
All right. Attorney Sprague?
Thank you, Your Honor. So, Dr. Tufts, back on that first appointment with Ms. Clancy on September 15th, 2022, as part of the record, did you detail a section, history of present illness?
Yes.
And in that section, you put in here initial presentation, nursing school, Prozac helped, got treatment after second baby, 2 for anxiety, Zoloft 1 week, was nervous about breastfeeding, initial side effects. Can you just tell us where that information came from?
My conversation with the patient.
Okay. And where it says Zoloft 1 week, was nervous about breastfeeding, what does that mean?
So she had tried Zoloft before during the postpartum period after her second baby.
And did she tell you whether she had any side effects when she took Zoloft after her second baby?
She mentioned something about initial side effects, which are pretty common for many people. I didn't detail what those side effects were, but they sounded like the very normal ones that people might experience that are transient in the beginning of the treatment.
And what would those side effects be?
Possibly upset stomach, appetite issues.
I apologize. Can we know what related to this patient rather than somebody?
All right. So why don't you ask if she remembers what the defendant said the side effects were?
Do you remember what the defendant said the side effects were?
I don't remember them exactly, but they were ones that did not seem concerning.
And in your experience, in your training and experience as a psychiatrist who prescribes Zoloft, what are the common side effects that you deal with, that patients deal with from this medication?
So in the first couple weeks of treatment, we described that there's a lot of serotonin in the gut as well as the brain. So the medicine often affects the gut first. So you might have diarrhea, constipation, difficulties with appetite, nausea, things like that.
And you also wrote in the note about history of present illness, 3 months postpartum, also 4 and 2-year-old feeling overwhelmed. Is that correct?
Yes.
And that came from the patient, Ms. Clancy?
Yes.
And furthermore, you wrote that the baby needing more attention, other kids more challenging too. Is that coming from the patient?
Yes.
And does she also describe she's having trouble leaving the baby, too anxious to do anything when she leaves, physical tension, heart racing, worries he won't eat or sleep because he's refusing the bottle?
Yes.
And did she say that makes her irritable?
Yes.
And in that same note is where you detail that she denied audio hallucinations, visual hallucinations. You also, correct?
Yes.
And you also detail suicidal ideation, homicidal ideation, denies, no concern about hurting baby. Is the no concern about hurting baby, is that an observation you're making or something that came from Ms. Clancy?
It came from our conversation.
So at some point in time, she told you she had no concerns about harming the baby?
Yes, it was.
I object.
Just an objection? If you could rephrase that question.
What did she tell you about her thoughts about the baby?
I asked if there were those thoughts, and she denied them.
And did you also provide information to her about what to do if in between appointments there were emergencies or issues?
Yes, I believe that I did. I usually do when I meet a patient.
And in the page describing treatment follow-up plan, which would be in the initial diagnostic assessment from September 15th in that treatment follow-up plan section, there's a part there that says, if having urges to harm self or others, go to the nearest emergency room, call 911, or call the National Suicide Prevention and Crisis Hotline, correct?
Yes.
Is this page given to the patient?
They can access it online on the portal.
So Ms. Clancy would have the ability to go on here, look at the portal, and see what to do if she was having a crisis.
Yeah, just this this plan section, yes.
Just the treatment plan section.
Yes.
So is it that she would have to search through the records, or is that something you can click on to see the treatment plan?
I'm not sure exactly what it looks like for a patient.
Okay. But that's one of the sections that's available to the patient, Lindsay Clancy, if she goes onto the portal.
Yes.
There's also in here, if you feel you're in crisis, you may text home to a certain text number from anywhere in the United States. Is that correct?
Yes.
And what does that do when you text that text number you text home to that text number?
It connects you to a counselor.
Now, what was the treatment or follow-up plan for Ms. Clancy?
To start the sertraline, to start individual therapy, and to follow up with myself.
So your recommendation wasn't just that she take pills, you recommended that she attend therapy, correct?
Yes.
And when you recommended the therapy, did you, and the medication, did you also go over with Ms. Clancy alternatives to the medication that you were recommending?
I believe she was aware that the alternative was that she could not take a medication, which is what she had been doing before.
And after you went over all of this information with Ms. Clancy, did she convey to you that she understood the plan and was agreeable to the plan?
Yes.
What is informed consent?
Informed consent means you communicate with a patient what the risks and benefits are of treatment, and they understand that and they agree to the treatment.
And did Ms. Clancy show that she had informed consent to everything you discussed?
Yes.
Now, was your next appointment with Ms. Clancy on September 28th, 2022?
Yes, it was.
And so during that appointment, did you discuss the medication, the Zoloft, that you had prescribed to her?
Yes.
And what did you learn from Ms. Clancy about whether or not she had taken that medication?
She shared that she decided not to take it.
Did she tell you that she had picked it up but had decided not to take it?
Yes.
Did she tell you how she was feeling?
She said a little bit better.
And did she elaborate on that?
The baby was getting some more sleep, so she was also able to get some more sleep, and that helped her feel better.
And at this appointment, did you go through a mental status exam of Ms. Clancy?
Yes.
And what is a mental status exam?
So a mental status exam is an assessment of the patient at the point of meeting. It can change at different times, but it's comprehensive, referring to how the patient appears, how they cooperate, how they speak, how they describe their thoughts, how they're able to communicate with you, and what their mood is like.
And do you do that at every appointment with every patient?
Yes.
And so on the September 28th, 2022, when you met with Lindsay Clancy for that second meeting, did you do a mental status examination?
Yes, I did.
And what was the result of that?
So I can, is it okay if I read it from the note, or do you just want me to?
There's no objection?
Go ahead, you may.
She was alert, she was oriented, she was appropriate, her rapport, meaning how she worked with me, was appropriate, dressed appropriately, euthymic, meaning not depressed, not angry, kind of a normal mood. Her affect was full, her speech was appropriate, her thought content and a process were appropriate. She did not mention any hallucinations. At this point, I mentioned her insight was poor, her judgment was excellent, her cognition was did not show any deficits, and there was normal psychomotor activity.
And why did you list that her insight was poor?
So I think that must have been related to the fact that at this point she did have some very clinically significant anxiety. Usually when people come to a psychiatrist, they believe that their symptoms are significant and that a medication is something that might be prescribed. But despite these symptoms, she still didn't want to try the medicine.
And what is the difference between a psychiatrist and a psychologist?
So a psychiatrist is a medical doctor. We go to medical school and then we specialize in psychiatry. A psychologist does not go to medical school. They may do a lot of research in their training. They may learn a lot about psychotherapy, but they don't learn about the human body, about how we metabolize medications and things like that.
And so can a psychiatrist prescribe medication?
Yes.
Can a psychologist prescribe medication?
No.
Now, in the medical records exhibit 219, page 47, it lists here recent lab work, no lab results were found. Is it that you had ordered lab work and you couldn't find the results, or that none were ordered?
None were ordered.
And why is that?
It was not necessary.
And why isn't it necessary at that point for Ms. Clancy to order blood work?
There's no blood work that is commonly done when a patient presents with generalized anxiety disorder and no other medical complications.
What types of situations would you order blood work for?
I mean, there could be a lot. Certain medications require laboratory monitoring, maybe something that, could affect the kidneys or could affect the thyroid, could affect the cholesterol. These are things that we monitor to make sure that the medicine is prescribed safely.
And so Zoloft, is that not one of the ones that would need to be monitored because of its potential effects on the body?
Correct.
And at that time, she reported to you she wasn't even taking it yet, correct?
Correct.
And your appointment that day, I think according to the records, it was approximately 17 minutes long. Is that correct?
So can I explain that?
Absolutely.
Because I think there's a bit of a misunderstanding. So the 17 minutes, I think people are looking at the note where it says a therapy start time of 10 a.m., a therapy end time of 10:17, so they're calculating 17 minutes. But those timestamps are specifically related to the therapy portion of the exam. They're not reflective of the complete duration of time when I met with her.
So what would be the complete time that you met with her on that day?
So I don't know the exact amount of minutes, but the appointments are 25-minute appointments, so it would be more or less a few minutes, about 25.
And so the 17 minutes that are for the therapy portion of the appointment, what comprises therapy? What does that involve?
It really varies based on the person, based on the situation. It can involve, providing some emotional support.
I apologize. Can we talk about Lindsay Clancy rather than in general? That's all.
It's
I'm going to allow a little bit of the background, so that then we'll move into the defendant.
Thank you. So you were saying that therapy portion is kind of talking to the patient, seeing how they are, and getting an assessment of their current mental state?
Yes.
And the other 8 minutes, typically, what happens in those 8 minutes?
That's more focused on specifically medications and medication management.
So these appointments that you had with Lindsay Clancy, when it says 17 minutes, that's the therapy, the talk portion of the appointment, and then there was a separate portion where medication was discussed?
Yes, in the real world, those two segments are intertwined. So it's not necessarily that we say, this is the end of your therapy component. It's a bit more seamless than that.
Now, in your training and experience in the way you conduct your practice, if you're having a therapy portion or you're conducting therapy with a client and that 25 minutes has run out, is it a hard stop or is there an option to continue?
It's not a hard stop. I do have limitations because I have other patients that are waiting. But if there's something urgent, I can go a little bit over. If there's an emergency, I can cancel the next patient if I have to.
Okay. And these 25-minute appointments that you have, if a patient were to request a longer appointment with you, is that available?
It's an option.
Did Lindsay Clancy ever request a longer appointment time with you?
No.
Now, that appointment on September 28th, 2022, was that also a virtual appointment?
Yes.
And did Ms. Clancy appear to be alone in that virtual appointment?
Yes.
And based on your conversations and assessment of her on that day, what was the plan going forward?
So at this point, she was improving, and we decided to pause on the medication question and have her meet with one of our therapists.
So that first appointment was on September 15th. You recommended therapy. The next appointment was September 28th. So had Lindsay not scheduled a therapy appointment yet with Jennifer McAllister at that point?
I'm not sure when she called to schedule that.
Okay. And but that was the plan going forward, that your recommendation was that she attend therapy with Jennifer McAllister?
Yes.
And did Ms. Clancy seem receptive to that plan?
Yes.
Did she tell you she was going to make an appointment with Ms. McAllister?
Yes.
Now, according to the records, the next appointment was October 3rd, 2022, just 5 days later. Was there a reason that you had such a short time span between that September 28th appointment and the October 3rd appointment with Ms. Clancy?
I believe that the patient must have scheduled the appointment on her own, and that's why the span of time was rather short.
Do you recall Ms. Clancy reaching out to you about getting paperwork for a maternity leave extension?
Yes.
And did she reach out to you through the portal for Astor Health?
Yes.
And did you respond to her on that portal?
Yes.
And did you fill out paperwork for her to extend her maternity leave?
I think that I did.
And so there is a message from Ms. Clancy to you on September 30th, 2022 in the portal that states, "Hi, Dr. Tufts. Thanks again for all your help at our last 2 appointments. While I am feeling just better enough to function without medication, I did reach out to my employer about extending my leave for reasons of postpartum anxiety/depression. I don't feel mentally well enough to return to taking care of patients with a baby at home that still won't take the bottle. I know this will trigger my anxiety too much, and also having to stay up all night as a nurse, I don't feel it's possible right now. They asked that my provider could fill out a form so they could process this request. Can I please send you the form to fill out?" And you responded on September 30th, 2022 at 2:41 p.m. This type of paperwork often requires a lot of information, so it's best if we go through it together in an appointment. Do you recall that?
Yes,
So would that have been why the October 3rd appointment was set up?
that may have been, yes.
And then do you recall receiving a message from Ms. Clancy on October 10th, 2022, stating, "Hi, Dr. Tufts, there is a part on the serious health condition form that you filled out for me that needs to be changed. On the second page, you put I could work a reduced schedule of 8 hours per day, 2 days per week. However, we discussed not working at all until January 1st. I think we talked about when I returned to work, that is what I could do, but that the way it appears on the form makes it seem like I can do that now. Do you still have the form to make the adjustment, or do I need to send it back to you?" And then you responded that you would send back an updated version. Is that correct?
Yes.
So do you recall having a conversation with Ms. Clancy at the October 3rd appointment about not returning to work and how long she should be out of work for?
I recall having a conversation about that.
And that January 1st date, was that something you decided or something Ms. Clancy requested?
I think it was something that we decided together.
And in that appointment on October 3rd, did Ms. Clancy tell you that she was on the verge of taking the medication?
Yes.
And did you discuss that with her?
Yes.
And what was that discussion?
Well, she was having more anxiety again. It seemed like maybe it had started getting better, and then it was kind of where it had been when she initially reached out, and so she was feeling like a medication might be helpful.
And did Ms. Clancy tell you at that appointment that she wanted to try therapy before taking the medication?
Yes.
But she had not had an appointment with Jennifer McAllister yet, correct?
I'm not sure what date her first appointment was with Jennifer McAllister.
Showing you page 57 of Exhibit 219, an initial therapy assessment by Jennifer McAllister on October 3rd, 2022. Would that have been the first time she saw Ms. McAllister?
Yes.
So that's on that same day that you saw her. It looks like from the records you saw her at 11:30. Is that correct?
I don't have the time on my paper, but I'm sure that's correct.
Okay, so apparently she saw you about the work form, and then she had an appointment with Ms. McAllister. Is that correct?
Yes.
And it says here in the records that Jennifer McAllister is an LMHC. What is that?
A licensed mental health counselor.
And so is a counselor, a licensed mental health counselor, someone who can conduct therapy sessions?
Yes.
And why is it in your practice that you have a psychiatrist who does therapy and prescribes medication, but in addition, you would have a therapist doing counseling?
So today, a lot of psychiatry is practiced as a team. At least that's how we practice at my office. So oftentimes the therapist is able to see the patient every single week. They're able to focus in more depth on certain aspects of the patient's well-being, and so it's helpful to have one person paying extra attention to the therapy component, especially when the psychiatrist does have to spend a lot of time discussing the medications and thinking about the medications.
And so is that the teamwork approach that Lindsay Clancy received in her treatment at Astor Mental Health?
Yes.
And in that October 3rd assessment with Ms. McAllister, you reviewed those notes and records so that you could properly treat Ms. Clancy, correct?
Yes.
And in that first meeting with Ms. McAllister, the defendant described her relationship with her parents as very supportive and stable, correct?
I don't have Jennifer's notes in front of me.
Showing you page 60. You want to just review notes?
Sure.
We'll look up when you finish. Does that refresh your memory as to the notes that you reviewed from Lindsay's session with McAllister?
Yes.
And so in that session, Ms. Clancy stated that her parents were very supportive and stable.
Yes.
And she also mentioned having the support of an older sister who only lived 2.5 hours away. Is that correct?
That's what she stated in the note to Jen.
Did she also say that she was not close with her in-laws who lived in Scituate? She would see them often as they were her husband's parents, but she didn't generally allow them to watch the children. Is that correct?
That's what I read.
And there's a quote in here, "Don't have a particular reason why, they don't bug me about it either." Is that correct?
That's what I read.
And October 3rd, 2022, when you met with her that day, did you again do a mental status exam?
Yes.
Had anything changed in that mental status exam from the September 28th meeting that you had with her?
Can I review it?
Yes.
I mean, there isn't anything that stands out to me right now.
And I think that what you put on the October 3rd date was that her insight was still poor.
Yes.
Was that for the same reasons you described earlier?
Yes.
The next time that you saw Ms. Clancy, was that on October 20th, 2022?
Yes.
And what information did you learn on that date about whether or not she was taking the Zoloft you had prescribed?
So she told me that she decided to start the Zoloft.
And did she tell you how long she had been taking it?
For 1 week.
And did she tell you that the previous night she had increased the dose?
Yes.
And that's what was in the original prescription, correct? To take the pills at 25 milligrams for 1 week and then increase to 50?
Yes.
So if that had been done, taking the pills for 1 week would be 7 pills, and then increasing the dosage the next night would be 2 pills?
Yes.
And so that would be 9 pills?
Yes.
When she told you she increased the dose, she told you she now feels awful, is that correct?
Yes.
And what was it that was bothering her?
She was having increased difficulty sleeping. She had loss of appetite, diarrhea. She was feeling her mood was down. She was tearful and feeling very foggy and feeling very anxious.
Now, what is the lowest dose of Zoloft that you would prescribe a patient or could prescribe?
The smallest pill is 25.
And what's the highest dose of Zoloft?
200.
Okay. So she was on the lowest dose of 25, is that correct?
Yes.
And then according to what she told you, she had increased for 1 night to 50 milligrams, is that correct?
Yes.
Did she also tell you she was scared to start something new?
Yes.
Is that in terms of another medication?
Yes.
So what was your discussion with Ms. Clancy when she's telling you that she's having these issues with Zoloft, but she's afraid to try something new?
So we discussed what to do moving forward. So we discussed whether it would make sense to switch to a different medication at that point. And at that moment, because of her negative experience with the Zoloft, she did not want to start a new medication at that point.
At this meeting with her, did you ask her if she had any suicidal thoughts?
Yes.
What was her response?
No.
Did you ask her if she had any homicidal ideation or thoughts?
Yes.
What was her response?
No.
Did you ask her if she was hearing any voices or seeing any visual hallucinations?
I'm not sure if I asked that in that appointment, but she was very clearly not psychotic.
And why do you say that?
Because of how I described some of the signs of psychosis that are on the mental status exam, none of those were present.
What was her affect during this meeting?
It was depressed.
And did you write that that she was? Strike that. What was it about her affect that made you write that she was depressed?
She visually appeared like she was feeling sad.
And her mood, how did she report that to you?
That was depressed as well and anxious.
What about her thought content and process that day?
That was appropriate.
And her speech?
It was appropriate.
And her judgment and cognitive skills?
Her judgment was excellent, and her cognition didn't have any deficits.
And her psychomotor activity?
Normal.
So the main change here from previous visits was that she appeared depressed and anxious.
Yes.
Although she had appeared anxious that first visit, correct?
Yes.
So to make sure we have the timeline correct, the first visit she appeared anxious, the second visit she appeared to be doing better, the third visit she still had that poor insight when you met about the paperwork, and then this fourth visit she appears depressed. Is that correct?
Yes.
Did she also tell you that she was worried about getting suicidal thoughts?
Yes.
So that would have come directly from her, correct?
Yes.
And what was that? What were the details of that conversation?
So it was one of the things that she was anxious about. It was a fear of one day having suicidal thoughts if she were to continue to feel poorly.
Okay. And showing you page 77 of Exhibit 219, I know you said earlier you weren't sure if you asked her about audio or visual hallucinations, but just directing your attention to the integral history, if that refreshes your memory.
Yes.
So did you ask her about audio hallucinations and visual hallucinations?
On the 21st, I did.
Okay. All right, so then there was an appointment the following day on October 21st?
Yes.
So why did she have an appointment that following day?
Because she was feeling pretty poorly after starting the Zoloft, so we were following her closely.
And at that point, you knew that she had had an appointment on the 3rd with Miss McAllister, correct?
Yes.
And do you know whether or not she had followed up making another appointment or was struggling with that? She was planning on making another appointment. I don't know when that second appointment was scheduled. When that first appointment where she was seeming depressed and having issues with Zoloft on October 20th, did you tell her to stop taking the medication at that point?
Yes, I did.
Okay. And did you discuss other options with her other than medication, like natural remedies?
Yes.
And what type of natural remedies did you discuss with Ms. Clancy?
So I mentioned things like fish oils, something called L-methylfolate or SEAM. These are supplements.
And why would you offer alternative remedies to a patient?
So it was because she seemed reluctant to start a prescribed medication. I thought she might be more open to something that was natural.
So you weren't pushing her to take a prescription medication, correct?
No.
Now, on October 21st, when you saw her, did she tell you that she hadn't been able to get any sleep the night before?
Yes.
You've already said she told you she wasn't having audio or visual hallucinations, correct?
Yes.
Did you ask her if she was having suicidal ideation or homicidal ideation?
Yes.
And what was her response?
No.
What was her affect that day?
It was depressed.
And did she tell you during your conversation that day that she had been anxious all day, not depressed or irritable, getting better?
Yes.
Okay, so she's telling you she's not depressed, but her affect to you appeared depressed. Is that correct?
Yes.
And is that for the same reasons you stated earlier, those visual cues that you saw?
Yes.
Did she appear hyper or manic in any way?
No.
Was there any changes in her rate of speech or pattern of speech?
No.
Was there any difference in her mental status exam?
No.
And this appointment, was this appointment virtual as well?
Yes.
Had all your appointments up to this point been virtual?
Yes.
Was she alone in that virtual meeting?
Yes.
What was the plan that was formulated on October 21st?
So the plan was that she start a medication called Ativan to be taken as needed, which means not necessarily every day, but in the instance of severe anxiety.
And how did you explain to Ms. Clancy when to take the medication?
I don't remember exactly how I explained that.
Okay. So in general, as a psychiatrist, when you're prescribing a medication like Ativan and you're telling a patient to take as needed, what does that mean?
So it means when the symptoms are present, and in this case in particular, when the symptoms are severe.
So with Ms. Clancy, what were the symptoms that she was experiencing that made you decide that Ativan would be an appropriate medication?
Anxiety.
So would it be when she was feeling anxious, feeling those symptoms of anxiety, that she should take the medication?
Yes.
And what was the dose again?
0.5.
What's the lowest dose of Ativan you can give?
0.5.
What's the highest dose?
Maybe 2.
Okay. So you started her at the lowest dose, the 0.5.
Yes.
And was there a specific time frame that you wanted her to try this in?
Yes, this was for 1 week.
And was the prescription for a 1 week amount, or is it hard to tell that because it's as needed?
It's hard to tell that without seeing exactly how many pills were prescribed.
And was there also, again, a recommendation to go to Ms. McAllister for therapy?
Yes.
And when were you recommending follow-up with Ms. Clancy?
1 week.
And why a short turnaround at this point?
Because she was still having very significant symptoms.
And did you in fact see her on October 26, 2022?
Yes.
And at that appointment, what was Ms. Clancy's affect?
Depressed.
What was her mood according to her?
It was anxious and depressed.
And did you discuss with her whether she was taking the Ativan and whether it was working?
She said that it was not helpful for her sleep, but it made her feel less anxious.
And in this appointment, there was a discussion of Benadryl. Is that correct?
So she reported that Benadryl was something she had tried and it was helpful. It was taken over the counter.
Had you recommended or told her to take the Benadryl at that point?
I don't think so.
And so when you met with her and she told you that she had taken the Benadryl and it had helped, what was your reaction to that?
I was glad that something was helping.
And did she tell you how often she was taking it or how much of it she was taking?
I don't recall.
Did you ask her that day if she had any suicidal or homicidal ideation?
Yes.
And what was the response?
No.
Did you see any signs of psychosis that day?
No.
Up to that point on October 26, 2022, had you ever had any difficulties in communicating with Ms. Clancy?
No.
Ever any difficulties understanding her or thinking she wasn't understanding what you were saying?
No.
At this appointment on October 26, 2022, did she tell you that she had scheduled an appointment for therapy with Ms. McAllister?
I don't remember. Oh, yes, she did. She said she has an upcoming appointment.
And what was the plan after meeting with Ms. Clancy on the 26th?
So at that point, we discussed trying a new medication because she felt that whatever side effects were caused by the Zoloft had resolved, but she still had the same anxiety that she had had beforehand. So we discussed starting the medication Buspar at 5 milligrams twice a day.
And what is the lowest dose of Buspar?
5 milligrams.
And what is the highest dose you can prescribe?
The pills probably come up to 30 and multiple 30 pills taken per day.
So you could prescribe someone more than 30 milligrams per day?
Like a total dose of 60.
Okay. So you started her again at the lowest dose?
Yes.
And why did you choose Buspar?
So Buspar is very well tolerated. It's a very mild medicine, especially for someone who is experiencing side effects from another medication.
And what does Buspar do?
It lowers anxiety.
And was she to continue taking the Ativan with the Buspar?
She could continue taking it as needed if she were to have those extreme moments of anxiety.
So would it be that the Buspar was twice a day, and then if she felt really anxious, she could take an Ativan?
Yes, because given that low dose of the Busparone, it might not have been enough of a dose to be effective right away.
And Buspar and Busparone are the same thing?
Yes, sorry.
There's also a note in here prescribing hydroxyzine 25 milligrams daily as needed for anxiety. What is that?
Hydroxyzine is an antihistamine. It's similar to the Benadryl that she had been taking for sleep. So I recommended that she try the hydroxyzine. It is a safer medicine to take compared to the Ativan. So if someone is feeling very anxious and they can take a hydroxyzine and that prevents them from needing to take the Ativan, that's good. So I wanted her to at least try that option instead.
So you gave her several options on how to deal with the anxiety as it appeared each day. Is that correct?
Yes.
And why take hydroxyzine, which is an antihistamine, instead of just taking the Benadryl?
So they're very similar, but hydroxyzine is indicated for anxiety, whereas Benadryl is really indicated for allergies.
And you discussed this plan with Ms. Clancy, and did she agree to that plan?
Yes.
And in discussing it with her, did you go over all the possible side effects and the interactions of the medications that you had prescribed?
Yes.
And did she voice any concerns about any of that?
No. I mean, I think she was still apprehensive about starting a new medicine and about potential side effects, but nothing specific.
Okay. So it was a general concern about medication in general?
Yes.
But after you had the conversation and explained what you were recommending and prescribing, did she agree to that plan?
Yes.
And was there any change in her mental status that day?
No.
Now going to the next time that you saw Ms. Clancy was at October 30, I'm sorry, was her next appointment on October 31st with Jennifer McAllister?
Yes.
So you were able to review in the records in preparation for your next appointment that she had in fact went to a therapy appointment. Is that correct?
Yes.
And the therapy appointment, was that approximately an hour-long appointment with Ms. McAllister?
Yes.
When was your next appointment with Ms. Clancy?
November 2nd.
And on that date, was that also a virtual appointment?
Yes.
Do you know whether the therapy appointment with Ms. McAllister was in person or virtual?
I'm not 100% sure, but I think it was virtual.
Okay. And up to this point, had Ms. Clancy ever told you that she didn't want to do virtual, that she wanted to come in person?
No.
Now, on this November 2nd appointment, did you have a discussion about the Buspar?
Yes.
And what was that discussion?
So she did not start it. She was too afraid to start a new medication.
Did she tell you that she had continued with the Ativan and the Benadryl?
She said she continued with the Ativan.
Ativan. Was there any further discussion about the Benadryl or the other antihistamine that you had prescribed, the hydroxyzine? I hope I'm saying that correctly.
You are, and I'm not sure. I don't think there was much conversation about the Benadryl or the hydroxyzine.
Okay. And what was her affect that day?
It appeared appropriate.
And what was her mood? How did she report feeling?
Euthymic.
What does that mean?
Euthymic means a normal mood, not necessarily sad or angry or euphoric. It's just kind of neutral in the middle.
And would that have been a word coming from Ms. Clancy, or just how you describe the word you used to describe?
It's a clinical word.
Clinical. And did you ask her if she had any suicidal or homicidal ideation?
Yes.
What was her response?
No.
Did you see any signs of psychosis present in her that day?
No.
That day, did you discuss alternatives to Ativan?
Yes.
And why were you discussing alternatives to the Ativan?
Because Ativan was not a medication I intended for her to be taking for a long period of time. It was a short-term medication.
And why is that?
Because it does have a risk of dependency when people take it for a long period of time, and especially at high doses.
So did you bring up this discussion about alternatives to Ativan, or did Ms. Clancy ask about it?
I think that was something I brought up.
And what were the alternatives that you discussed with her?
Remeron, trazodone, pregabalin, and hydroxyzine.
And what was it about those medications that you thought they would be appropriate for Ms. Clancy?
That they might be safer medications that could also help her with sleep, also help her with some of the anxiety.
And how are they safer?
So they don't have that risk of the dependency.
And while you're interacting with her and discussing the alternatives to Ativan, what was her mental status that day? Was there any change in it?
No.
And so after this discussion with her about the alternatives, was there a decision made on how to proceed?
Yes. So we discussed tapering the Ativan by 0.25 milligrams every 2 weeks.
And what does tapering mean?
It means slowly reducing.
And why do you slowly reduce the medication?
So when you are taking Ativan, like I mentioned, the risks of dependency, there's also risks of withdrawal symptoms if a medication like that is abruptly stopped. So that's why we gradually decrease it.
And so if the plan was to decrease it by 0.25 milligrams a week, what amount was she taking per week?
So it was by 0.25 milligrams every 2 weeks.
2 weeks, okay.
So at first, we were decreasing it from 1 to 0.75.
Okay. So it was a 1 milligram pill that she was taking, and then she would just take less and less and less until she wasn't taking it any longer?
Yes.
Okay. And then had you, with Ms. Clancy, decided on a replacement for the Ativan?
At this point, I don't think there was a medicine that we had decided on.
Okay. So the plan at that point was just to taper off the Ativan, but nothing was added at that point?
Yes.
Did you next see Ms. Clancy on November 22nd, 2022?
Yes.
And do you recall why there was a 20-day gap between seeing her on the 2nd and then seeing her on the 22nd?
Well, I'm not sure. I would really be guessing if I said.
Okay. Did you learn at that appointment on November 22nd of 2022 that Ms. Clancy had started another program?
Yes.
And what program was that?
It was a South Shore perinatal mental health clinic.
And was that the first that you learned of Ms. Clancy being involved in that program?
Yes.
Did she tell you she was thinking about doing it, or that she was already enrolled in that program?
That she was enrolled in it, and that what it sounded like she was going to be transferring her care there.
Okay. And did she tell you that she was starting a new medication?
Yes.
What did she tell you she was starting?
She said she was going to start Prozac.
And did she also tell you that what she was currently using for medication?
Yes.
And what was that?
The Ativan and the Benadryl.
And did she tell you that was for sleep as needed?
Yes.
And so you had put in place a plan on November 2nd to taper off the Ativan, but on November 22nd, she was still on the Ativan. Is that correct?
Yes.
And had she tapered off or reduced the dose, to your knowledge?
I don't have it documented exactly what dose she was taking on that date. She was just still taking the medicine.
Still taking it, okay. On that date, did Ms. Clancy deny suicidal and homicidal ideation?
Yes.
Did she show any signs of psychosis?
No.
Did she also tell you that she was going to be transferring her therapy care to that South Shore Perinatal Health Clinic?
Yes.
So basically at that point, the plan was for her to receive her mental health care at the South Shore Perinatal Clinic and no longer see you? Was that the plan? Okay. Was there also discussion of a return to work letter that day?
Yes.
And did she request that from you?
Yes.
And did you give her a return to work letter?
Yes.
And was that authorizing her to return to work immediately or on January 1st as the previous form had said?
I don't remember what date it was for her to return to work. I don't think it was immediate.
Did you then have a further appointment with Ms. Clancy on December 1st, 2022?
Yes.
And how is it that, she was planning on transferring care to the South Shore Perinatal Clinic on November 22nd, but then on December 1st, she has an appointment with you?
So patients can schedule their own appointments. I'm not involved in the scheduling. I can schedule an appointment if someone asks me to, but they can schedule it without my awareness. So she had scheduled it.
Okay. So she hadn't reached out to you in advance to ask about it. She just scheduled an appointment with you for December 1st, 2022. Is that correct?
Yes.
Okay. And in that appointment, did she tell you that she ended up not returning to work?
Yes.
And what was discussed at that appointment?
That she wasn't getting better.
And in what ways wasn't she getting better?
She had tried the Ativan taper, But without the Ativan, she was having a lot of difficulty sleeping. So she tried a few different medications, a few different medication combinations, but she was having trouble with them.
And did she tell you what types of medication she had tried?
Yes.
And what were those?
Trazodone 50 to 150 milligrams was minimal effect. Ativan and Benadryl combination was helpful. Then she added the Prozac 10 milligrams with the Ativan and Benadryl to help with the sleep, but she still had worse sleep, so that was stopped. Then she tried a combination of Remeron with Klonopin, but she felt disoriented, had rebound anxiety, and it was of minimal help. Then she tried Remeron and Seroquel, and that was prescribed, but she didn't take it.
And these medications that she was talking to you about, those weren't prescribed by you, correct?
Correct.
Did she tell you that those had been prescribed by her provider at South Shore Perinatal Clinic?
Yes.
And what is Trazodone?
It is the category is an antidepressant, but the doses that we use are low, so it's really a sleep medicine.
And what is the lowest dose of Trazodone?
50.
And what is the highest?
It can go very high, up to maybe 600.
Okay. So the 50 to 150 milligrams that Ms. Clancy told you she had taken, is that on the lower end of the dosage?
Yes, it's the commonly prescribed dose, again, because it's mostly used as a sleep medicine. So those are the normal ranges.
Okay. And Prozac, I think you had said earlier, was an SSRI?
Yes.
And that was a medication Ms. Clancy had told you she had taken in nursing school, correct?
Yes.
With no side effects then?
Yes.
And she told you on December 1st, 2022, that the Prozac had worsened her sleep?
Yes.
And then what is Remeron?
Remeron is mirtazapine.
And what's that?
It's another antidepressant.
And what is Klonopin?
It is a benzodiazepine like the Ativan.
So prescribing Remeron as an antidepressant and Klonopin as an anxiety medication, is that an unusual combination?
No.
And then she told you she had been prescribed Remeron and Seroquel but hadn't started that, correct?
So I think she had started the Remeron, but maybe hadn't started